One of Nigeria's leading non-governmental organizations, Sickle Cell Advocacy and Management Initiative, commemorates the World Sickle Cell Day. This non-profit organization caters to low-income indigents and calls on the government to invest and create more awareness and facilities in the sickle cell space. XTRA Care program focuses on the physical health and wellness of warriors. According to Tony Adishola, founder Sickle Cell Advocacy Management Initiative, the goal is to reach the general community with advocacy, education, information, and counseling about sickle cell and allied matters.
We bridge a gap between the person living with sickle cell and the hospital, because you know that when you don't have money, the lower indigents who don't have money, they would rather not go to the hospital because they are afraid of the cost. And by then, it's too late to help the child. So we decided to organize the clinic to serve as a bridge between the patient and the hospital, so that if we notice anything, we are able to support in some way, and we'll also notify them. But they also get free drugs to be able to reduce the number of times the child has crisis.
It's children and adults, and right now we have one of our oldest beneficiaries is 62 years old. Our oldest beneficiary. So from children and adults, male and female, without regards to ethnic or religious affiliation. So we are open to all and sundry here.
They have been helpful, really. They have been helpful. Like since I joined, I've not been buying drugs. Everything here is free.
There's a lot of things I'll be gaining from SAMI since I've joined SAMI. Like what you don't know, they'll allow you to know it. What you don't supposed to use, the drug that you're supposed not to use, they'll allow you to know. What you're supposed not to eat, they'll explain better to you from the other people that have said that a sickle cell cannot be somebody in life. A sickle cell can be somebody in life. A sickle cell can be a doctor. We have a doctor's sickle cell.
We call out on individuals, members of the public, to come on the platform, donate as little as 1,000 naira to the SAMI advocacy to help in reaching more warriors, because beyond the World Sickle Cell Day, they are doing this on a monthly basis and even on a daily basis. So there's so much funds needed.
Generally, it's been, during the COVID period, it used to be a bit more frequent, but now it's just like every third Saturday of the month. So we just come, a couple of us here, about 5, 6, and we just run clinics for them. So what we try and assess is to try and assess the sickle cell patients. Try to see how often they are on their medications, all right? In some cases, we try and examine to see if there's anyone that has a serious condition. But because this is just a sort of an outreach, basically, we tend to write referrals to the hospitals for very serious cases, all right? We also try and organize talk shows, radio shows, and stuff for the patients to have a better understanding, you know, of what sickle cell actually means.